Goni skill ankle dorsiflexion talocrural joint. Position the patient sitting with the knees flexed to 90 degrees. Make sure the foot is in 0 degrees of inversion and eversion. Be sure to test the unaffected limb first. In patient-appropriate language, ask the patient to dorsiflex. Assess the tibia and fibula for knee extension and hip rotation. Use one hand to move the foot into dorsiflexion by pushing on the bottom of the foot. Avoid pressure on the lateral border of the foot under the fifth metatarsal and the toes. A considerate amount of force is necessary to overcome the passive tension in the soleus and Achilles musculotendinous unit. As you stabilize the tibia and fibula to prevent knee extension and hip rotation, the end of range of motion occurs when resistance is felt and additional motion causes knee extension. Assess the end feel of the joint. This should be firm because of the tension in the posterior joint capsule, the soleus muscle, the Achilles tendon, the posterior portion of the deltoid ligament, the posterior talofibular ligament, and the calcaneofibular ligament. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the lateral malleolus. Align the stationary arm with the lateral midline of the fibula, using the head of the fibula for reference. Align the movable arm parallel to the lateral aspect of the fifth metatarsal. Be careful not to use the head of the fifth metatarsal as a reference. Palpate the entire lateral aspect of the fifth metatarsal to ensure you get an accurate measurement. Ask the patient to perform ankle dorsiflexion as previously done, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the hip and the knee. Read the degrees of motion on the goniometer and then ask the patient to return the leg to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion, according to the American Association of Orthopedic Surgeons, is 20 degrees.